Some things to avoid during pregnancy. When you're pregnant, what you don't put into your body, or expose your body to, is almost as important as what you do. Here are some things to avoid. 1. Alcohol. Although it may seem harmless to have a glass of wine at dinner or a mug of beer out with friends, no one has determined what's a safe amount of alcohol to consume during pregnancy. One of the most common known causes of mental and physical birth defects. Alcohol can cause severe abnormalities in a developing fetus. Alcohol is easily passed along to the baby. Who is less equipped to eliminate alcohol than the mother? That means an unborn baby tends to develop a high concentration of alcohol, which stays in the baby's system for longer periods than it would in the mother's. And moderate alcohol intake, as well as periodic binge drinking, can damage a baby's developing nervous system. If you had a drink or two before you even knew you were pregnant, as many women do, don't worry too much about it. But your best bet is to not drink any alcohol at all for the rest of your pregnancy. 2. Recreational drugs. Pregnant women who use drugs may be placing their unborn babies at risk for premature birth, poor growth, birth defects, and behavior and learning problems. And their babies could also be born addicted to those drugs themselves. If you're pregnant and using drugs, a health clinic such as Planned Parenthood can recommend healthcare providers, at little or no cost, who can help you quit your habit and have a healthier pregnancy. If you've used any drugs at any time during your pregnancy, it's important to inform your healthcare provider. Even if you've quit, your unborn child could still be at risk for health problems. 3. Nicotine. Pregnant women who smoke pass nicotine and carbon monoxide to their growing babies. The risks of this include A. Prematurity. B. Low birth weight. C. Sudden infant death syndrome, SIDS. D. Asthma and other respiratory problems in the child. If you smoke, having a baby might be the motivation you need to quit. Talk to your healthcare provider about options for kicking the habit. 4. Caffeine. High caffeine consumption has been linked to an increased risk of miscarriage. So it's probably wise to limit or even avoid caffeine altogether if you can. If you're having a hard time cutting out coffee cold turkey, here's how you can start. A. Cut your consumption down to 1 or 2 cups a day. B. Gradually reduce the amount of caffeine you get by combining decaffeinated coffee with regular coffee. C. Eventually try to cut out the regular coffee altogether. And remember that caffeine is not limited to coffee. Many teas, colas, and other soft drinks contain caffeine. Try switching to decaffeinated products, which may still have some caffeine, but in much smaller amounts, or caffeine-free alternatives. If you're wondering whether chocolate, which also contains caffeine, is a concern, the good news is that you can have it in moderation. Whereas the average chocolate bar has anywhere from 5 to 30 milligrams of caffeine, there's 95 to 135 milligrams in a cup of brewed coffee. So, small amounts of chocolate are fine. 5. Food smarts and other precautions. Although you need to eat plenty of healthy foods during pregnancy, you also need to avoid foodborne illnesses, such as listeriosis and toxoplasmosis, which can be life-threatening to an unborn baby and may cause birth defects or miscarriage. Foods you'll want to steer clear of include A. Soft, unpasteurized cheeses, often advertised as fresh, such as feta, goat, brie, camembert, and blue cheese. B. Unpasteurized milk, juices, and apple cider. C. Raw eggs or foods containing raw eggs, including mousse, tiramisu, raw cookie dough, homemade ice cream, and Caesar dressing, although some store-bought brands of the dressing may not contain raw eggs. D. Raw or undercooked meats, fish, sushi, or shellfish. E. Processed meats such as hot dogs and deli meats, unless they are reheated until steaming. Also, although fish and shellfish can be an extremely healthy part of your pregnancy diet, they contain beneficial omega-3 fatty acids and are high in protein and low in saturated fat. You should avoid eating A. Shark. B. Swordfish. C. King mackerel. D. Tilefish. E. Tuna steak, big eye or ahi. F. Marlin. G. Orange roughy. These types of fish may contain high levels of mercury, which can cause damage to the developing brain of a fetus. When you choose seafood, limit the total amount to about 12 ounces per week, that's about 2 meals. Also, if you like canned tuna, Pay attention to the type in the can. Canned light tuna generally contains smaller fish and can be eaten twice a week. But albacore white tuna contains larger fish and should only be eaten once per week. Check any local advisories before eating recreationally caught fish. 6. Changing the litter box. Pregnancy is the prime time to get out of cleaning kitty's litter box. Why? Because toxoplasmosis can be spread through soiled cat litter boxes and can cause serious problems, including prematurity, poor growth, and severe eye and brain damage. A pregnant woman who becomes infected often has no symptoms but can still pass the infection on to her developing baby. 7. Over-the-counter and prescription medicines. Even common over-the-counter medicines that are generally safe may be considered off-limits during pregnancy because of their potential effects on the baby. And some prescription medicines may also cause harm to the developing fetus. To make sure you don't take anything that could be harmful to your baby. A. Ask your healthcare provider which medicines, both over-the-counter and prescription, are safe to take during pregnancy. B. Talk to your healthcare provider about any prescription drugs you're taking. C. Let all of your healthcare providers know that you're pregnant so that they'll keep that in mind when recommending or prescribing any medicines. D. Also remember to discuss natural remedies, supplements, and vitamins. If you were prescribed a medicine before you became pregnant for an illness, disease, or condition you still have, talk with your healthcare provider, who can help you weigh potential benefits and risks of continuing your prescription. If you become sick, e.g., with a cold, or have symptoms that are causing you discomfort or pain, like a headache or backache, talk to your healthcare provider about medicines you can take and alternative ways to help you feel better without medicine. In conclusion, healthy pregnancy habits, from start to finish. From the first week of your pregnancy to the 40th. It's important to take care of yourself so you can take care of your baby, even though you have to take some precautions. And be ever aware of how what you do, and don't do, may affect your baby. Many women say they've never felt healthier than during pregnancy. Happy pregnancy!